Vortioxetine, a major depressive disorder. What is major depressive disorder? Major depressive disorder, also known as clinical depression, is a mental health disorder that affects how you feel, think, and behave. It can be caused by genetic, environmental, and psychological factors. According to the European Medicines Agency, depression can be chronic and affects up to 15% of people in their lifetime, which for women can go up to 25%. Symptoms of major depressive disorder. It is characterized by having some of the following symptoms for 2 weeks or more. Behavioral issues, which include depressed mood, loss of interest or pleasure, feeling worthless or excessively guilty, impaired concentration, problems with sleep, which include insomnia or hypersomnia and fatigue, or problems with eating, which can include significant gain or loss in appetite and weight. What is vortioxetine? Vortioxetine, sold as Brintellix, is a selective serotonin reuptake inhibitor, an SSRI, that is used in the treatment of major depressive disorder. Mechanism of action. SSRIs work by selectively inhibiting 5-HT reuptake at presynaptic cells, allowing for serotonin to bind at postsynaptic cells. This causes increase of serotonin levels within the brain. SSRIs are the first-line treatment, and the time of action is much faster than other groups of antidepressants with less side effects. Indications and co-indications. The indication for vortioxetine is for treatment of major depressive disorder in the general population, and is not recommended for use for patients under 18. Co-indications for vortioxetine are hypersensitivity, and that it's not meant to be used with irreversible, non-selective MAOIs at all. Adverse effects. Common side effects of vortioxetine are nausea, diarrhea, constipation, and vomiting. Through continued use of the drug, these effects will lessen over time. More serious side effects of vortioxetine are serotonin syndrome, hemorrhage, mania or hypomania, and seizures. If these are experienced, it's highly recommended to seek urgent medical help.
Clinical results of vortioxetine. Vortioxetine is significantly more effective than placebo. Relapse rates during the first 24 weeks of the study showed 13.2% in vortioxetine groups and 26% in the placebo group. The effectiveness of major depressive disorder treatment in relation to functional outcomes is related to the suppression of depressive symptoms and the improvement in functional impairment, as well as premorbid functioning, such as daily life, including school, work, interpersonal relationship, and overall social functioning.
To manage major depressive disorders, there are many pharmaceutical drugs utilized, including selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, and tricyclic antidepressants. As we know, vortioxetine is an SSRI and hence considered as first line of therapy due to the favorable risk-to-benefit ratio. However, this drug also acts as a 5-HT agonist, antagonist, and transport inhibitor, making it pharmacologically different than other SSRIs. Vortioxetine is well tolerated, taken orally at doses of 5, 10, or 15 mg per day. Common side effects of the drug include nausea occurring in 38% of patients, headaches, and dizziness. As compared to the SNRI duloxetine, vortioxetine has similar sexual dysfunction rates. Duloxetine is also administered orally with higher doses at 60 mg per day for major depression. One major adverse effect, however, is the increased risk of suicide. Amitriptyline, being a TCA, has potentially serious side effects including anticholinergic effects which SSRIs such as vortioxetine lack. It is for this reason amitriptyline is considered a second line of therapy, although having a similar positive effect to that of vortioxetine, with 50 to 70% of patients responding to treatment. In relation to cost, a month's supply of vortioxetine costs approximately $254, in comparison to duloxetine, which costs approximately $35, and a month's supply of amitriptyline costs approximately $15. Although costly, however, due to its lower side effects, vortioxetine is now being considered to be as first choice in relation to duloxetine and amitriptyline.
Safety of vortioxetine. The aim of the study was to determine the efficacy and safety of vortioxetine in adults with MDD. The method used had all patients receive 5 mg of the drug, then, depending on drug tolerability, they were split into groups with either a higher or a lower dosage. Treatment-emergent adverse effects were reported by 70.6% of the study participants. The most frequently reported TEAEs were nausea, headaches, and diarrhea. All these events are mild, therefore it can be assumed that vortioxetine is safe.